Hello, my name is Dr. Eric Green. I'm the Program Director for the Internal Medicine Residency at Mercy Catholic Medical Center. In this video, I want to try to tell you about some of the highlights of the clinical learning environment for the Internal Medicine Residency at MCMC. Mercy is a community teaching hospital located in Darby, Pennsylvania, just a few miles from the Philadelphia city line. We proudly serve residents of West and Southwest Philadelphia, as well as the areas of Delaware County that surround our hospitals. Our communities include a wide spectrum of socioeconomic status and a large number of immigrants, many from West Africa. We are a safety net hospital that proudly serves as a primary care hospital for all of our local residents. Our patients come to us for conditions ranging from the common strokes, MIs, COPD, to the more exotic tropical diseases, weird and esoteric cardiac, pulmonary, neurologic, rheumatologic problems. As a full-service hospital with a full suite of medical and surgical subspecialties, we're able to treat our patients in-house with only rare needs to transfer to tertiary quaternary centers. Mercy is also unique in that it is a resident-centered GME area. By this I mean we have no fellows. There's no fellows to steal the procedure. No fellows to monopolize the attending's time. No fellows to act as an intermediary between the resident and the board-certified attending who is truly their faculty member. We feel this direct attention to residents, while intimidating at first, provides them with the best learning environment because they have the ability to learn directly from all of their attendings. The hospital is a certified stroke and cardiac chest pain center, and we care for patients with all sorts of medical problems. Rather than describing all the things that we do treat at Mercy, I often like to describe the conditions we don't treat. For a number of reasons, we do not have pediatrics or obstetrics in our hospitals, so you won't be seeing kids, which in an internal medicine residency is probably good, and we'll have only limited exposure to pregnant women, as women in their third trimester typically would be transferred out to a facility that had on-site obstetrics. We do not do solid organ transplants or bone marrow transplants, nor do we care for patients with burns. Aside from that, chances are, if the patient comes in, we can treat them, and we do. At Mercy, our illness severity on our floors spans a wide spectrum, ranging from observation patients to seriously ill patients in our step-down unit. Most of our teams are organized geographically, where our resident teams, our intern, resident, and attending, focus on patients on 1 to 2 floors. On these teams, the residents get to know and work very closely with the other floor-based clinicians and ancillary health professionals in our hospitals, our nurses, our social workers, our case managers, our physical and occupational therapists. Our other teams are organized with a specific focus in mind. For example, a type of disease or a type of attending. Those teams allow our residents to get experience for a different way of organizing a patient care flow. In this way, our residents are prepared when they enter independent practice for a wide spectrum of practice and hospital organizations. Our ICUs care for our sickest patients and have the capability to do almost anything that they would need to, including advanced technology like intracranial pressure monitoring, continuous veno-veno hemodialysis, therapeutic cooling. Basically, if it's possible, we almost certainly can do it. Our ICU team consists of a consistent group of residents who work together throughout a whole block. During the course of the block, interns and residents work with each other on different day and night shifts under the guidance of an experienced group of teaching intensivists. Through this organization, Residents get the full spectrum of ICU severity and education while undergoing a concentrated, dedicated learning block. Our elective experiences pair our residents closely with an attending, often shadowing them not just in the hospital, but working with them in their ambulatory clinics. In this way, our residents get an in-depth exposure to a specific discipline and learn so much directly from our attendings. Our ambulatory experiences, both our continuity clinic and ambulatory blocks, have a dual purpose. We of course want to teach our residents the principles of primary care, general internal medicine, but we also instruct them in the core principles of ambulatory care. We recognize that ambulatory care is a very different environment than inpatient care, where evaluations are thought of as taking months to years rather than hours to days. We are confident that the skill set we give our residents during the ambulatory rotations are useful to all of our residents, whether they go into hospital-based medicine, subspecialty medicine, or primary care training. Our emergency departments are a fantastic laboratory with skilled emergency medicine faculty and a population of patients who present with a wide variety of complaints. Our emergency medicine has two aspects. On some rotations, our residents are acting as an emergency medicine resident, working directly with the emergency medicine faculty in initial evaluation of patients coming into the hospital from the triage. In our AOD, or admitting officer of the day rotations, our residents act as the first contact for the medical service, screening and triaging patients designated by the emergency medicine physicians for admission to the appropriate level of care and initiating their care. We hope you'll explore the rest of our website and the other videos here to find out more about the internal medicine residency at Mercy.